It's deadly and it's becoming more dominant by the day. From the UK to Indonesia, the Delta variant is spreading around the world like wildfire. But does anyone know what it will take to defeat it? I'm Melinda Nusafora, and this is the Newsmakers. Well, it first emerged in India late last year. Within weeks, thousands were dead and thousands more were fighting to breathe as the Delta variant of the coronavirus took hold. Now, the deadly strain has spread to more than 130 countries as it becomes the fastest and most dominant mutation in the world. It already accounts for 95% of new cases in the UK and most infections in Europe. More than 90% of people testing positive in the US are now affected with it. The data shows vaccines will protect the vast majority from serious illness, but the majority of the world still hasn't received those vital jabs. Keisha Ferguson breaks down the numbers.
Nearly 4.5 billion doses have been administered globally. Around 15% of the world's population is fully vaccinated, with 40% of those doses administered in China. Only 1.5% of Africa's more than 1 billion people have been fully vaccinated. More than 203 million cases have been reported globally. The US tops the list with almost 36 million reported cases, followed by India with 32 million and Brazil with more than 20 million. The US, Brazil, and India also report the highest fatality rates. Many cities in Australia and China have returned to full lockdown. While across Europe and the UK, lockdowns are being lifted and restrictions eased, while plans for an EU-wide vaccine passport are underway.
As of now, there are 11 variants of the coronavirus, but the Delta variant has public health professionals most worried. So what sets it apart? Well, for one, it's far more contagious, spreading 60% more efficiently when compared to the original Alpha strain. Some scientists believe it could be the most contagious virus in living memory. What makes that even more concerning is that it's likely to be the most dangerous coronavirus strain of them all. Many Delta patients have reported symptoms not seen in the majority of other variants, including severe headaches, sore throats, and runny noses. But more worrying is the level of serious illness, with recent studies showing you could be twice as likely to be hospitalised. So who's fighting this deadly variant in the best way? To discuss that, I'm joined now from New York by Dr. Eric Feigl-Ding. He's an epidemiologist and senior fellow at the Federation of American Scientists. Oksana Pyzik is in London. She's a biochemist and senior teaching fellow at the University College London School of Pharmacy. And Jaya Dantas is in Perth, Australia for us. She's a professor at Curtin University School of Population Health and a Dean of Health Sciences. Thank you all so much for joining us here on the Newsmakers. Eric, I'm going to start with you. Some countries, such as the UK, are opening up. Other countries, like Australia, are still shutting down. Who's doing it right?
Well, given how contagious the Delta variant is, I think taking the precautionary principle is always the best measure. This is twice as contagious as the original strain. It is by far one of the most contagious viruses we've seen in our lifetime, and it is among unvaccinated people 4 times to 5 times more severe, greater risk hospitalization. So we should not just flippantly, cavalierly allow the virus to spread, which will only fuel more mutations. So I think the more restriction approach, and restriction does not mean all lockdowns. It can mean better masks, premium masks, whether it's KN95 masks or N95 masks, would be really good, combined with ventilation and air disinfection standards for buildings. Then we can make schools and public buildings safe.
Well, with that in mind, Jaya, let me ask you, COVID fortresses like Australia, like New Zealand, they were hailed as the benchmark for COVID treatment or tackling this virus, but now they're being criticised. How sustainable is an approach like Australia's?
So, with Australia, Australia went with the zero community transmission policy. And right since last April, they decided that they would actually have strong lockdowns. And at the same time, they closed their borders to people traveling into Australia and outside Australia. One of the things that has been successful in Australia is we've had very little community transmission till about 6 weeks ago. So I live in Western Australia, and at present we have no community transmission of COVID-19 in the community.
But you're
The
seeing
only
so
COVID
much
that we
community
see in Western
transition
Australia.
along the East Coast. So,
Yes.
really, can Australia just keep closing itself off for when? Forever?
So, at present, in the last 6 weeks, we've seen a surge of the Delta variant in New South Wales and Victoria. But as compared to other parts of the world, the daily cases are still low. And now there are calls to have an approach where we would open up cautiously, but we can't do so now currently because our vaccination rates are still low.
Vaccination rates are doing better, Oksana, in the UK, and the UK's approach is vastly different to Australia's. Do you think that UK has gone too far one way, Australia too far the other, or do you think the UK is striking the right balance now?
Well, I think the UK has a significant burden on its healthcare system. We see that health workers are burning out, many citing mental health issues. So it's not without consequence. That and over 2 million people who have even contracted even mild cases of COVID have reported ongoing symptoms and complications of long COVID. So time will tell to see how those individuals' health will affect even the healthcare system itself, as they will develop chronic conditions and need continuous care. I think that because the UK is far ahead of Australia in terms of vaccination rates, it does mean we have a sufficient wall to prevent totally overwhelming the healthcare system. And even now, we're seeing lower cases than what was originally projected for coming into the summer post Freedom Day. So that has been interesting, but that decline is now leveling off, and we are starting to see an increase of hospitalizations once again. The US is immunizing their young people, children, and I think this is going to be, come September, a big problem for the UK, potential resurgence, because JCVI, which is our vaccine task force, has not gone ahead to recommend vaccinating kids. And if we're going to want to reach herd immunity, I think that's going to be necessary.
I'm going to come back to children in a moment, but Eric, I do want to ask you, when we talk about vaccines, we have people saying, well, you can still catch COVID even though you've been vaccinated. So clearly these vaccines don't work. What would you say to them?
Well, vaccines do work. They reduce your risk of having a breakthrough infection by 3 to 4 to 5-fold. They definitely work. And if you do get it, your viral load immediately goes down much faster than the viral load of someone else. So basically, you will have mild. Now, the concern is that of governments that try to rely on just vaccine-only approach and no mask. That is dangerous because the vaccinated people can have more asymptomatic transmission and transmit it onward to those who are not vaccinated. So that's why you really need to mask. And although the viral load is similar for the first few days, it quickly drops off in the subsequent days. And your chances of getting of breakthrough infections is much, much lower. Vaccines work really great against hospitalization prevention. These are really great hospitalization prevention vaccines, but they're loose and leaky against transmission, and that's why you still need to mask. But that doesn't mean that vaccines don't work.
Jaya, there's been a low vaccine take-up in Australia, but also there's been vaccine hesitancy right around the world. Why do you think people are still believing these conspiracy theories about vaccines and not believing the science?
I think one thing that has happened this time with COVID-19 has been the huge amount of social media. So you've had conspiracy theories as well as you have had the anti-vaccination movement around the world that has impacted the uptake of vaccination. The other thing that Australia did is we had a certain amount of complacency because we had such low community transmission. And at the same time, our government made it completely voluntary. So it did not mandate vaccination for anyone except for those working in hospital settings. So even our aged care workers they did not mandate it for aged care workers. Among the elderly, they didn't mandate it. And as a result of this, there's been a lower uptake. So even though people want to take the vaccine, they have had a wait and watch approach. The second thing that we've had in Australia is this whole issue about the order of the vaccines in the sense with respect to Pfizer and AstraZeneca. So first the AstraZeneca was rolled out for the over 50s. This changed to then over 60s. And then suddenly it changed to anyone over 40s. So this mixed messaging also had an impact with respect to the vaccine rollout.
Mixed messaging, definitely not a good thing there. Eric, I want to go back to you with a US example now. We've been hearing lots of news about the number of young people in the States who are now being hospitalised with COVID. Is this particular to the Delta variant? Why are we seeing so many young people sick now?
Yeah, children definitely are affected more than ever. The Delta variant, keep in mind, yields a 1,000-fold higher viral load, higher virus concentration in your body, and it yields it about 2 days faster than the original strain. So you develop symptoms much faster. And similarly for children, the concentration viral load is much more. And so what used to be like mild for most kids is now getting much more severe. And many scientists acknowledge that. And this is why we need vaccine mandates for teachers. This is why we need masks for kids, high filtration masks, not just cloth masks, because ICUs are record high. And in the US, more children are now hospitalized with COVID than ever before in the pandemic. And we've seen this in many other countries. India, we saw this unusual phenomenon of greater severity in children too. We just chose to ignore it or turn a blind eye. Delta variant is here and is a clear and present danger to not just the unvaccinated, but also specifically, notably, children.
What kind of push, Oksana, is there to have young people vaccinated in the UK? You said this is going to be a problem come September when school's back.
Well, I would hope that JCVI reconsider the recommendations in terms of age groups. I think university students definitely we need to come to them to ensure that we have facilities set up on campus, and that anyone who's not yet had their vaccine, ensuring that they have that protection before going into indoor classrooms. But also, as Eric had already highlighted, there is a lot that we can do beyond vaccines. I think we need to be looking at in offices, in university campuses, in schools, having air purifiers. I know that this is what's happening in New York, but it's not being discussed at all amongst the key decision makers in the UK, or has been a focal point in the media. And clean air, we need to demand just in the same way that we expect clean water.
It's an interesting point. I mean, talking about clean water has long been a topic, but clean air. So you think this needs to be a greater focus?
Yes, and it need not be very expensive either. We can a lot of hospitals are already equipped with specific filters that help to disinfect those environments. And this isn't just about COVID. This type of air filtration system can help reduce flu and other respiratory viral diseases that are commonly in circulation of past and any that we might encounter in future. So the compound benefits extend way beyond COVID-19.
Jaya, let me bring you back in here. I want to ask, do you think that employers should be able to ask of their employees if they've been vaccinated?
So this morning we had the Australian Treasurer on the news actually say that the onus is on the employers to mandate vaccines for their employees. So this is a problem, I think, because I think as a government we can actually take a firmer stand in mandating vaccines among the population. We know the severity of the Delta strain. We know it is in the country. We can't keep the hard borders and the lockdowns continuing and ongoing for extended periods of time. We have pandemic fatigue in the community. We have protests against lockdown. And although our main goal is to increase vaccination rates as well as to keep the community with as much as low community transmission as possible, what we have to realistically see is how we can actually roll out the vaccine more effectively. By putting the onus on the employer, it makes it much more difficult because now, for example, GP practices, other employers are asking for some amount of indemnity, or if people take them to court in terms of a rights-based issue, because all this while, vaccinations were voluntary in Australia.
What do you think, Eric? I saw you shaking your head there for a moment. What do you think? Should employers be able to ask that?
I think there should be mandates. I think there should be verifications. And some places the mandates are either vaccine or COVID negative tests on a weekly or every few day basis. I think I wasn't disagreeing with that. I think the main issue is that this singular hope that the vaccine alone will stop Delta. It is not enough. Delta spreads so fast, and we don't have vaccines for children yet under 12. And again, in UK, they're callously, ridiculously not giving it to children under 16 yet. It is not enough because the R naught is now 6 to 8. It is faster than smallpox, and it is one of the most contagious things. And what used to work will not work anymore. Was it Australia's strategy last year does not contain it anymore, as you can see in New South Wales. And so we need more. We need vaccine plus other measures. And we talked about premium masks, as mentioned before, but also notably the ventilation and air disinfection with HEPA filters, MERV 13 filters, UV, upper air UV. Those are all recommended. Don't go with any other side gimmicky things. HEPA filters and upper air UV. These are the best things to ensure indoor air quality and disinfection to stop this airborne virus. We have to do more. It must be multi-layered, not just one single, let's hope vaccines will stop it all and then let's go back to normal. No, Delta is just way too contagious.
Well, if we look beyond Delta, what about the Lambda variant, Oksana? Is that something that we should be getting concerned about now too?
Well, and it's not necessarily going to stop just at Lambda, particularly if we do find that there is resistance to those other measures that Eric's laid out, as well as if vaccine mandates fail in other countries or are resisted. So Lambda is currently being investigated by the WHO, and we'll have more information on the severity of that. But it looks like Delta currently is the variant of concern that has a link to more severe outcomes and twice as likely to be linked to hospital admissions. Keeping a close eye on Lambda, but a real emphasis on the fact that we could work through the entire Greek alphabet here. I also agree with our other colleague that putting it on just the employers themselves is putting those organizations in a very difficult position legally and otherwise, and really absolving the government of specific responsibilities. I think that we do need to find ways to also not just to get access to those hard to reach communities. Here in the UK, one way that we have overcome anti-vax or even vaccine hesitancy, which isn't it's not the same in the sense that people have legitimate concerns and questions. They aren't against all vaccines. They just want to understand more about the COVID-19 vaccine. And I think that public health bodies have to do better at engaging with these communities. And there has been a socioeconomic link as well. The most disadvantaged groups have been the most resistant in the UK towards getting it. However, by working with religious leaders, making vaccines available at places of faith and of worship has really helped to change that. And we've seen an uptake in some of those most resistant groups because of measures that extend beyond the mandate. But I think, unfortunately, to reach herd immunity, we do have to push vaccines uptake as hard as we can, including in younger children, and ensuring that those who have would like to learn more about it have a forum for that.
Right. I want to bring Jaya back in here. Sorry to cut you off there. I want to bring Jaya back in just briefly and ask, what do you think about the chances of a super variant? Could we get to a point where we've got a variant that's resistant to our vaccines?
At this stage, what we have seen with COVID-19 is that there are 4 variants of concern and 4 variants of interest here. So we know that viruses mutate, and this virus could mutate. We know that Delta Plus has already spread to over a dozen countries. So that we have this Delta Plus strain that has been identified in India and in 12 other countries. We just don't know enough at this stage with respect to the severity of future variants that might come up from the virus here. And once we see that countries have reached possible herd immunity, like in India and countries like Bangladesh, where we have huge populations, we've seen antibodies where it shows that they have reached a certain amount of herd immunity, possibly in those countries. But we don't know that as yet. And we just need to see how the virus acts in real time, in real communities as we go along. Yeah?
We're almost out of time, but Eric, I want to ask you that same question just very briefly. What do you think? Could we get a super strain?
Well, I think it's not outside the realm of possibility. You know what increases the chance of that? If we keep letting it spread. If we allow this, natural infection approach that Boris Johnson and Secretary Javid is pushing, live with the virus. Mass infection is not a strategy. Mass infection, as the WHO Director of Emergency Programs, Dr. Mark Ryan, says, it is morally empty and epidemiologically stupid in every way. And that's quote unquote a WHO official at a WHO press conference on this. And so if we want to just live with the virus, we're going to live with much worse and worse viruses. If we don't mitigate, we will eventually see the virus evade the vaccines even more and become more severe. They said it could become someday we might have a super strain, super severe strain if we let this go. So let's not get there.
That is a dire warning for us to end on. Dr. Eric Feigl-Ding, Oksana Pyzik and Jaya Dantas joining us on the Newsmakers. Thank you for your expertise and your time. And to our audience, thanks for watching us. We'll see you next time on the Newsmakers.